Namaste. In today's video, we will focus exclusively on the Ayurvedic management of osteoarthritis, a condition Ayurveda calls Sandhigata Vata. Let's explore the holistic therapies that will help you regain mobility and reduce pain. In Ayurveda, osteoarthritis is treated by addressing the root cause, that is the imbalanced Vata. Treatments are aimed to balance dosha, reduce inflammation, nourish the joints, and restore the body's natural balance. Correcting the acne and improving the metabolism is also very crucial. One of the most effective approaches for treating osteoarthritis is Panchakarma. Panchakarma is a detoxification program which aims at removing the toxins and cleansing your body, thus preparing it for a complete healing and rejuvenation. Panchakarma consists of 5 cleansing procedures. These procedures will be done according to the age and strength of the patient to withstand the treatment. If you have severe indigestion, therapeutic vomiting called Vamana will be done if your age permits. The second Panchakarma is Virejana, which is gut cleansing. The third Panchakarma, known as Vasti, is the most important treatment in osteoarthritis. In this, Kshiravasti is especially beneficial as it helps to nourish the joints. The fourth Panchakarma is Snehavasti. It helps in lubricating the joints. The fifth Panchakarma is Nasya. It's done if necessary. Along with Panchakarma, external therapies will also be done. The therapies will be chosen according to the current condition of your joints. Anti-inflammatory treatments like Dhanyamala Dhara, Lebanam, which is application of medicine paste, and bandages will be done in the initial stage. Once the inflammation is completely resolved, joint strengthening and nourishing treatments like Piju, Tailadhara, nourishing bandages known as Upanaha, and Vasti on the Sandhis, that is, pooling of oil on the affected joints are done. Along with these treatments, specified diets according to your acne or digestion and constitution is very important. If you have a weak digestion, take very light and warm foods like khichdi or light porridges and warm soups. Spices like ginger, cumin, pepper, turmeric and asafoetida can improve your digestion if used judiciously. This can be included in your cooking. Also, drinking water boiled with cumin or ginger can also help in improving your digestion. Once your appetite is improved, you can shift to a more nourishing diet. Rice, especially a variety known as Nyavara, is very good in nourishing and strengthening the joints. This rice is heavier than rest of the rice varieties. So, take it in small quantities if you have a good digestion. Judicious use of ghee, mostly cow ghee, and oil, especially sesame oil, are best in improving the joint health and lubricating them, and also keep savada under control. Mutton soups made with the bony parts are very good as it helps in replenishing the depleted bone marrow in OA patients. Make sure to have freshly cooked and warm food according to your appetite. Bitter, spicy, cold and dry foods increases vada, so avoid them. But bitter taste is very good in improving joint health. So process the bitter drugs with milk. This will help in replenishing and nourishing the bones and joints without increasing the vada dosha. If you have low appetite, the nourishing food that should improve bone health will turn into ama or toxins as the body is not able to digest them. This will in turn worsen your health. Gentle movements and exercises are crucial in keeping your joints mobile. Ayurveda recommends yogasanas tailored to your specific condition and walking at a comfortable pace. Surya Namaskara is a very effective yogasana as it helps in stretching the spine and strengthening it. Gentle exercises that can improve the joint mobility are very important. Do a little bit of strengthening exercises according to your strength so that the muscles become stronger and they can withhold the joints in position. Avoid high impact exercises as your bone tends to be weak. Practice pranayama. It is very beneficial in controlling the vata in your body. Ayurveda gives great importance for the mind-body connection. Stress is a major factor in most of the chronic disorders. Stress is an inevitable part in today's world, but keeping it at bay and not allowing it to affect your health is very crucial. Practicing pranayama, meditation, and mindfulness will help you in this. At Dheemahi Ayurvedic Center, we provide customized treatment plans for osteoarthritis. Each therapy is tailored according to your unique constitution, ensuring maximum effectiveness and comfort. If you are ready to explore how Ayurveda can help in osteoarthritis, visit Dheemahi Ayurvedic Center. Our experts are here to guide you on your journey to a pain-free living.